Hey guys, it's Tiffany with Texas Orthobiologics. Today I'm going to be presenting a regenerative medicine case study of a patient that we saw recently involving his right knee. It's going to be over chronic patellar tendinitis. Down here at the bottom, you can go to orthobiotexas.com to check Dr. Buford and I out. So the patient was a 37-year-old male. He presented with chronic right knee pain for several years, and his pain is located at the inferior edge of his patella. He does have a history of jumper's knee as well as Osgood-Schlatter as a kid, and this has continued into adulthood, causing him activity limitations, especially with basketball. Over here, we have a lateral view of the right knee on x-ray. If you look at the inferior end of the patella as well as the proximal end of the tibia, you can see the large calcifications or the osteophytes that are located within the patella tendon. We did an ultrasound of the knee to visualize the calcifications and also look at the health of the tendon to see if we saw any hypoechoic areas, to suspect any tearing of the tendon. Right here, we start at the inferior end of the patella. We're going to be in long axis. This is going to be at the proximal end of the tibia and long axis. You can see that very large calcification within the tendon. No hypoechoic regions around it to think any acuity in the calcium. This is going to be that same view, but then we spun it into short axis, visualizing that calcium within the tendon. Perfect. So we went over several treatment options with the patient. Steroid for us is going to be a no-no, especially in tendons due to its catabolic nature and susceptibility of weakening the tendon. We discussed PRP versus stem cell. These are great options because they're anti-inflammatory, they increase blood flow, and also strengthen the tendon. We discussed Toradol, but this wasn't the best option because this is more chronic, and we usually use Toradol when it's an acute injury. We discussed surgery to remove the calcium versus a procedure called 10X. We also discussed oral medication. So we gave the patient indomethacin, and he decided to go with 10X. 10X is going to be, if you look down here at this picture, we use ultrasound guidance for this device, and this goes in using ultrasound signal to break up the calcium and to remove it. Thank you guys for watching.